Making sure I'm showing. All righty, good morning, everybody. Okay, so we are back with our public health syllabus. So we talk about some intro. We talked about public health on the global level. We started to talk about public health on the national level, right? Talking about some of the national government organization governing various parts of public health. So we'll continue that, finish that off, and then we'll talk about roles of pharmacists in public health. And just as a reminder, next week, Tuesdays and Thursdays, I'll send out an announcement, given the number of people here, is that those two classes on epidemiology and population health, part one, part two, by Dr. Moroganji is required attendance. So also note that exercise one is opening up next week, Thursday, and it is due the following Friday. Okay, exercise one is kind of like your practice questions for your quiz one. Okay, and also your study guide, so to speak, for your quiz one. So those were based on your epidemiology practice questions, as well as some other mock questions or sample questions on some of the other materials that we have covered. Okay, any questions on the syllabus thus far? Right. Okay, so let's go back to what we were talking about in terms of our national public health government agency. So we kind of went through, so as we went through what some of the overview of the Department of Human Health and Human Services agencies. So we'll talk about these, each of these agencies, give you a little brief overview of what these agency does. Okay. And so the National Institute of Health. Okay, so I do believe that everybody has heard of the National Institute of Health. It is the nation's our largest medical research agency. It is the largest source of funding for medical research in the world. Okay, and it provides funding in terms of training researchers, funding for a lot of the things that potentially other NGOs or other NPOs would not be looking at, or other universities would not be looking at. They provide funding to encourage research in these other organizations, these non-governmental organizations or universities. Okay, includes 27 institutes and centers, each with a specific research agenda. So you can see that it provided a lot of funding, and that created a lot of Nobel Prize winners that discover a lot of pivotal research. Okay. And also NIH encourage and depends on public involvement. They have what we call patient-centered research, which is one of our lecture topics in the upcoming lectures. Okay, so I would encourage you guys to take a look at the NIH.gov virtual tour. It gives you an idea of how big NIH is and all the various different institutes. And particularly if you encounter patients that is telling you that, they have a rare illness that currently on the market, there is no drug that treat their rare illness. You can encourage them to look on NIH.gov. There are clinical research trials that's ongoing that they can participate in order to find some remedies or find some ways to treat the real rare illness that they have that does not have an FDA approved treatment. Okay. You can also look on clinicaltrials.gov as well. All right, the Centers for Disease Control, or the CDC, okay, works to protect America from health, safety, and security threats, not only in the US, but also in other countries. The CDC is our primary health protection agency. Okay, so don't forget that to fill in the missing words on your slide. Okay, the Primary Health Protection Agency is the CDC. And so about every month, I believe, or every week, actually, excuse me, is that they will provide a system of national and global research surveillance report. This is called the MMWR, the Morbidity and Mortality Weekly Report, that tells you all the data point that the CDC have collected concerning health surveillance. Okay? And the CDC also responds to threats when they arise. So if you think about the COVID-19 pandemic, the CDC was really, in the news, telling you about the trends of where the COVID cases are happening, and also updates on vaccination as well. So the CDC is present. They have field officers almost in every state here in the United States. Okay. The headquarters is in Atlanta, Georgia. And you can see like the distribution of the field officers that is present in each of the states. I try to dig for some budget distribution. The latest one that I can see is from that has color coding that is a little bit easier to read. Otherwise, it's just a main budget sheet. This just to give you an idea of what the CDC is doing in terms of you can see that in all these different colors. The more of the color or more space of that color means the more of the funding that goes towards it. So in the fiscal year of 2022, $2.9 billion goes towards, so this purple is protecting Americans from infectious diseases. Okay. So they also have areas where it's environmental in nature. So that's also part of the CDC jurisdiction, keeping Americans safe from environmental and work-related hazards. There is also ensuring global disease protection, as well as monitoring health and ensuring laboratory excellence. That's also one of the reasons why CDC have field officers in all the different states, is also to ensure the labs are also up to their standards. Okay. There's also a part of the budget, $652 million, that goes towards protecting Americans from natural and bioterrorism threats, as well as preventing and leading causes of disease, disability, and death. So the research portion of this. Another interesting organization that I feel like you should know on the national level is called the Agency for Health Research and Quality. And their mission is to produce evidence to make healthcare safer, higher quality, more accessible, equitable, and affordable. Okay. It works on to make sure that the evidence is understood and used. Here, I give you an example. They had a specific project that was done. This is a great resource for pharmacists. It is called the AHRQ Pharmacy Health Literacy Center, and they provide 7 health literacy tools specifically for pharmacists. And if you click on any of these links, that will take you to these courses as well as resources to help you to understand, and also to help your patient to more understand about their health. Okay. So I have here some curriculum models, some resources, as well as health literacy tools to improve communication for providers of medication therapy management, which is all of you. Okay, so these are, again, tools in your toolboxes, resources that you can take with you as you go along and become great pharmacists. Yes.
How do organizations differ in mission? The AHRD and the National Institute of Health. How do
Yeah.
they differ in terms of their mission? Because it seems like they are doing the same.
Yeah, so very good question. So the question is, how do the mission of NIH differ from AHRQ? So NIH is like your general umbrella for all your medical research. Okay. They have 27 different institutes that specifically focus on different research topic of interest. Okay. That's all research, right? And then for AHRQ, it is specifically focusing on healthcare and healthcare quality. So it's very specific in its scope and its mission on in terms of researching and finding tools or creating resources that is going to provide healthcare providers evidence to make healthcare more quality, okay, to improve the quality of healthcare. So it's AHRQ is specifically focused on that making healthcare safer versus NIH is a broader aspect of providing funding for all different medical related research. Does that kind of make sense? So NIH is more broad, and then AHRQ is very specific on focusing on quality of healthcare. That kind of makes sense.
And there'll be a department in NIH that also talks to quality, or it could be like a sub.
It's not a subdivision of NIH, AHRQ in its own government or organization that's separate to NIH, as far as I understand. But I can double check on that. But it is a separate entity. Okay. They probably do have collaboration on some levels, but it's separate to NIH. Good question. Any other questions? Yes, so I would encourage everybody to take a look at the specific Pharmacy Health Literacy Center. Again, these are tools for your toolboxes. So the FDA, right? Food and Drug Administration. A lot of pharmacists, if you want to work for the governmental organization, they do end up working for the FDA because us as pharmacists, we are medication expert, right? And the FDA is in charge or responsible for protecting public health by assuring the safety, the efficacy, and the security of so you can see here, there's a list of things. So not only your human drugs, but also veterinary drugs, okay, drugs for your pets, biological products, medical device, food, cosmetics. So if you think about tobacco products, products that emit radiation. Okay, so not only the food and drug aspect, but also the medical device aspect, cosmetic aspect, and the let's say supplements as well. That's regulated by the FDA. Okay? It advances public health by helping to speed innovations and making medicine more effective, safe, and more affordable. So we'll talk about examples of FDA approving generic drugs, right? We all know that when a pharmaceutical company comes out with a new drug, it's a brand name drug. However, over the years, it loses patent. Then the FDA have this abbreviated process in terms of for other manufacturers to produce this drug in generic form, which is better for the patient in terms of its costs, right? The cost of generics, we all know that is a lot cheaper than brand name drugs. And also, last but not least, it also provides the public with accurate scientific-based information they need to appropriately use the medicine and foods. So this is a little on in terms of the FDA, in terms of the various offices that it has. And just a very quick, let me see here. Give me 1 second. Okay. My apologies. I do have an updated slide on that update in terms of the the various departments of the FDA in terms of the most updated organizational chart. Okay, this is from August 2025. Okay. So it is a little small, but you can see on your side, your version of the slide, they have all these various centers. Okay. Um, the one that the pharmacist works for the most is probably the Center for Drug Evaluation and Research. Okay. So the Center for Drug Evaluation Research, this is the hone in like the snippet of specifically for the Center of Drug Evaluation and Research, there are different offices. Okay. So different offices, the Office of Generic Drugs, they're specifically approving and looking at generic drugs. Office of New Drugs, looking at new drugs. Okay. So I know that a lot of pharmacists, they work for either of these offices under the Center for Drug Evaluation and Research, also known as CDER, CDER. So if you know that, people talk about, oh, I work for CDER, that stands for Center for Drug Evaluation and Research. A little bit about the FDA budget. As you can see, a lot of it goes towards strengthening the FDA's public health and mission support capacity. Capacity meaning their workforce, okay? And also advancing food safety and nutrition, as well as advancing the safe and effective medical products, okay? And so here I found in terms of the distribution, this is for the fiscal year of 2024 by program and source. You can see a lot of it goes towards human drugs, okay? And a lot of it comes from the user fees. User fees meaning that these pharmaceutical companies, they're looking for approval from the FDA. They will provide fees for the FDA in order to go through that process of drug approval. So you can see that about over here in terms of these money also goes towards food, as we mentioned in our previous slide, in terms of the list of the jurisdiction of the FDA, not only human drugs, but also food, tobacco products, the biologics, and they also have some for animal drugs and also toxicological research. So here is a little infographic, again, concerning the FDA, that it oversees the safety of more than 3.9 trillion worth of food, tobacco, medical products that's produced in the US and abroad. So you can see what is the breadth that they're working with. And so the FDA regulated products accounts for about 21 cents of every dollar spent by US consumers. Okay. So a lot of our tax, we're getting taxed on various products that goes towards funding the FDA in order for it to ensure that you are getting the most safe and effective drug and food products. CMS, the Center for Medicare and Medicaid. This is the division that administer Medicare as well as giving funding to the states to run Medicaid programs. Okay, they also are in charge of the Children's Health Insurance Program, and also known as CHIPS, and parts of the Affordable Care Act. So fiscal year 2024, it has a budget of $1.5 trillion, which accounts for 22% of the total federal spending. Okay. So you can see here in terms of enrollment to Medicare and Medicaid, it is definitely increasing over the years. And over here, just a quick overview. We mentioned that 22% of the federal budget or funding of is goes towards Medicare. 17. So here it's the nation's healthcare dollar fiscal year of 2024. 17 goes towards Medicaid. So this is just specifically for healthcare as a big pie. 22% Medicare, 70% Medicaid. You have 31% as part of private insurance, and some are out-of-pocket costs. Some are for government public health agencies and for third-party payers. Okay, so an overview of the nation's healthcare dollars. All right. So we briefly browsed through some of the main national organizations. Okay. Let's go through what are some of the state and local public health agencies. Okay. And so for state and local public health is all has to do with our city's health department as well as the county health department as well as community organizations. So if you think about all the advocating agencies or organizations that we partner with, whether it may be also other community organizations such as churches, such as recreational center, and if you think about the participants of state and local public health is also our community members, us as healthcare providers, okay, and also the layperson. So on in terms of the state and local authority, so we kind of talked about international authority. It is voluntary. They have very little authority. However, in terms of your national authority, so such as national organizations such as FDA, they can mandate, right? There are laws and legislation that's passed in order for these organization or for these laboratories, for example, for manufacturers to follow in order to ensure safety and efficacy of the whether it may be food or drug products, medical device that they produce. Now moving on to state and local authority. So state and local departments carries out powers not given to the federal government in the US Constitution. So, based upon the 10th Amendment, makes states the primary protector of health. Okay. And in the state health department, you have health officers that are part of the state board of health. You have also tribal health departments, and these state or local health department also reports to national agencies such as the CDC. So if you think about locally for us in Maryland, Maryland, we have the Maryland Department of Health. Specifically relating to us is the Board of Pharmacy. Okay, and so if all of you going to become pharmacists, you need to pass your NAPLEX exam, as well as you're going to need to pass a Maryland Pharmacy State Law exam. Okay, that's if you want to be practicing in Maryland. And so every 2 years, you need to be registered with the Board of Pharmacy. You need to renew your pharmacist license with the Board of Pharmacy, like I have to do this year. Okay. And so part of that CE, part of that continuing education, you can also be attending the Board of Pharmacy public meetings. Okay, so 2 hours each, up to two meetings for full continuing education or CEs. Okay, so for Maryland, as I mentioned, in terms of Medicaid program, it is instituted or implemented by the state. And so for here, I've included some of the state health programs, the Maryland Children's Health Program, as well as for Medicaid provider information. So in the future, if you happen to work with Medicaid patient and you need provider information, the Maryland Department of Health has a lot of those information for you. So these are again resources for you when you need it. Okay, and also there is a link here to the Medicaid pharmacy program. Okay. Last but not least, some community organization. So if you think about the roles of community organization play in public health, okay, think about the advocating organization that we partner with, right, serving the underserved population. A lot of them are leading the efforts to gain attention from the government officials once a particular public health issue has been identified. And all these community organizations also create additional avenues for the provision of services that promote and protect public health. So for us as community members, all of us here are community members of this community. And then in the future, when you become pharmacists, you will become members of the community that you're serving in. All right. So it's really important for us to be looking for trends, identifying public health problems based on the patient population that you're serving. Okay. And understand and support public health intervention whether it may be your local health department or your state health department implementing these public health interventions and programs to assist on those programs. Also, you can assist on designing public health interventions when you see a particular trend, right? That idea of that upstream public health that we talked about. Okay? And holding the government accountable for protecting and promoting health. So, such as voting, right? Voting on representatives that will represent your voice and your opinion in terms of state legislation and national legislation. Okay. Pharmacist responsibility to public health organization here. So get involved, right? Wherever you may be practicing, get involved in your professional organization, whether it may be local, okay, or on the state level, as well as on the national levels. So a lot of we'll talk about in our next upcoming lecture on the roles of pharmacists is that a lot of the legislation leads efforts by our leading professional organization, such as the American Pharmacists Association. We'll talk about a little bit of resources on some legislation that they are working on. And so how we could help as individuals. They have drafts of letters that you can send to your local representative. So get involved, right? Be an advocate. Okay. And also on the state level, there is the prescription drug monitoring program. Who has heard of the prescription drug monitoring program? If you work on a community pharmacy level, you would know that. Okay. In terms of how do you expand those, right? Currently, it's as far as I know, it's still limited on the state level. However, if you think about people can travel, right? So how do we expand that prescription drug monitoring program so that it covers collaboration between different states so that we can monitor this opioid crisis better, right? And so on the federal and national levels, you can be a part of a national professional organization. There's many of them, right? And you can be on task force, you can be on committees that are looking at legislation or looking at better processes on how to move pharmacy practice forward. And internationally, if you're interested in global health, Dr. Maria Ng is coming to talk about global health, and you can also understand about what are some of the efforts. You can participate in voluntary medical and humanitarian aid. Okay, you can raise awareness on the international level in terms of what is some of the best pharmacy practice here in the US and teach or share experiences with other countries' pharmacists. All right, so that is public health at a local, state, national, and global level. Any question thus far or anything? A very brief overview, but I hope that, this is just to let you guys be aware of these organizations and some of the resources that it provides. So those again are your tool in your toolboxes. All right, so let's talk about roles of pharmacists in public health. Okay. So, first question, I have a little analogy here. Does anybody like traveling? Yeah, okay. A lot of people enjoy traveling. So, if you remember your first time on the airplane, does anybody remember when they were first on the airplane? At what age were you? Does anybody remember? 18, okay. Anybody else? 10, okay. Yeah. All right. So if you remember that excitement of like waiting in the airport, right? Waiting and you see this big airplane and you're getting on the airplane. Does anybody like a window seat or aisle seat? Anybody window seat? Window seater. Okay. Yes. Depends on how long the flight is. I like that. Okay, yes, I hear ya. Okay, I used to be a window seat person. Now I'm definitely anybody aisle seat. I'm definitely an aisle seat person now. Ah, that's right, right. You don't want to be sitting too long. You don't want those blood clots to develop, okay? So you got to be standing up and stretching, moving around, right? Okay, and then whenever you need to, I always hydrate. So I go back to Taiwan and see my family. It takes like 21 hours up to 24, 28 hours, right? So what I've learned to, this is a tip for everybody if you don't know, to get over jet lag faster or to feel, energetic after the flight is to be always drinking water throughout the flight. So that's why I pick an aisle seat because, after drinking water, you need to go to the bathroom, right? And so remember that. And so once, if you're on window seat or aisle seat, if you open up the windows, you can see beautiful terrains, right? Depending on where you fly over, beautiful terrains. You can see beautiful patterns, right? You can see all the different. So on a bird's eye view, everything looks a little different, right? You have a broader perspective. You can see trends. You can have different ideas, okay? And so traveling the world here is my analogy in terms of for you guys to think about public health as on a bird's eye view, right? Where you are looking at the population that you're taking care of, and you're trying to see some health trends. You're trying to see issues not only on the individual level, but on a population level. And you're trying to think about ideas on how you can help population health, not just individual health, but also population health. A bird's eye view, overviewing that health trend, monitoring, as well as thinking of interventions on how to improve health outcomes, not only on the individual level, but on a population level. So objectives for this roles of pharmacy in public health to describe the roles of pharmacists in achieving optimal medication-related patient outcomes. We're going to discuss public health-related responsibilities of pharmacists according to the American Society for Health System Pharmacists, also ASHP, who is one of our largest, if not the largest, organization representing clinical pharmacists provide examples on how pharmacists can be involved in public health in areas described by ASHP. All right. So us as pharmacists, medication is our what I like to call our bread and butter, right? Bread and butter, meaning that everything surrounding the medication we need to be aware of, we need to be advocates, and we also need to educate, whether it may be patients or other healthcare provider, in terms of assuring the access to medications. Okay, so not only it's the provider prescribing the medication, but you as pharmacists ensuring that the patient has access to the medication, right? Assuring the medication are safe and effective, assuring the medication are used in a safe and effective manner. So every medication that you see the patient on, there should be a reason why they're on the medication. So an indication for every medication that they're on. Okay, and identifying and resolving problems associated with the use of medication, okay? Whether it may be educating them on side effects, whether it may be, nurses will come and ask you in the hospital setting how to administer a particular medication. Can you administer these two medications together in one line? Okay. And so all those identifying and resolving problems that arise. Okay. And all this is all to say is to achieve optimal patient outcomes. So assuring access, assuring medication safe and effective, and there's an indication or used in a manner that is safe and effective in identifying and resolving problems associated with the use of medication. All right. So the American Society of Health System Pharmacists, ASHP, has the statement on these roles of pharmacists in public health. Okay, so there's six of them. I'll go through each of these and then we'll elaborate on each of these. So number one is providing populational based care. Number two is to develop disease prevention and control programs, including chronic disease or disease management treatment programs. Number three is to promote medication safety efforts in institutions and communities. Number four is to engage in opioid stewardship efforts, including prevention, intervention, and treatment. So the idea of stewardship. So if you guys heard of antimicrobial stewardship, everybody heard of antimicrobial stewardship. So if you think about what is antimicrobial stewardship, is pharmacists looking at the patients who are on antimicrobials, ensuring that they're on the right antimicrobials for the pathogen that they're treating, right? The right dose, the right route, the right frequency. Okay, I'll always be talking about dose, route, frequency, right? Indication, dose, route, frequency, as well as very important for antimicrobial, the duration of treatment, right? So ensuring all that is appropriate and correct, that is your antimicrobial stewardship. So kind of similarly, opioid stewardship we'll kind of talk about is also ensuring that patients who are on opioid indeed need the opioid. So we talk a little bit about the step-up therapy in upcoming slide. Five is to develop health education policies and programs within the institution. So wherever you'll be working, whether it may be community, hospital, managed care, is you have that health education policy and program component to wherever you're providing care for your patients. Okay. Not only providing health education to your patients, as well as again to healthcare professional, also be thinking broader aspect in terms of the community leaders in the community where you are serving as pharmacists. Okay. Number six, to be advocating for sound legislation, regulation, public policy regarding disease prevention and management. I mentioned to get involved, right? To get involved in your local organization, state and national organization, and able to advocate. Always we're thinking about advocating, but advocating for your patients, for the community that you're serving. Number seven is to engage in public health related research, education programs, and to be able to initiate that campaign to disseminate new knowledge and provide training programs. Okay, so that is why we are doing a exercise, or one of the biggest assignment is your public health campaign. And a lot of the times in public health, you'll be working in groups, right? You'll be working in a team. And hence, we're trying to mimic that environment of working in a team to come up with a public health campaign. So elaborating on each of these, number one here is your population-based care. So focusing on groups of individuals defined by specific characteristics other than demographic, such as a health determinant or disease state. Okay. And this here is the ability to develop population-specific evidence-based disease management program and protocol based upon the analysis of your epidemiologic. So we talk about epidemiology and population health, as well as pharmacoeconomics data. So we'll talk about pharmacoeconomics in upcoming lecture as well. Medication use criteria, medication use review, and risk reduction strategy. Okay. So here there are some examples of prevention on how to this idea of population-based strategy. So remember we talked about upstream public health intervention, meaning that it is focusing on people who are healthy or they are healthy or they are at risk for some illness or some disease. So two types of prevention in this upstream public health intervention is what we call primordial prevention, meaning that you are preventing the risk factors, okay, versus primary prevention is you are trying to prevent the illness or injury from happening the first time. Okay, so some example here if we're talking about smoking. Okay, so the primordial prevention here is policies, but public health policies such as banning smoking in public areas or banning smoking indoors. Does anybody happen to know when this ban of smoking in public areas happened? Any? Okay, it happened around the early 2000s. Okay, early 2000s. So if you recall, like back in the days in the 60s or the 70s, they have these advertisements where smoking is cool, right? And then afterwards, they looked at epidemiological data and they found out that a lot of smoking is actually bad for your health, right? And so over the years, there's legislation, as more data, that more evidence come out about all these bad health effects of smoking. Then there's legislation about banning secondhand smoking, right? Banning smoking in public, okay, and banning smoking in indoor areas. So banning smoking here is what we call preventing the risk factors. So just the fact that you're not breathing in all those secondhand smoke, okay? And that is preventing some risk factors. The risk of you breathing in that secondhand smoke that could lead to smoke-related illnesses down the road. Okay? Primary prevention here is preventing the illness or injury. Or primary, we can think about is as prevent the behavior from happening in the first place. So you have the government, you will see sometimes there are anti-smoking campaigns. They are, taxes on cigarettes, right? Different state have different legislation concerning taxes on soda, your sugar beverages, as well as on cigarettes, right? So if you go to New York City, right, if you see how much cigarette costs versus how much it costs in other southern states, you will see there's a big difference, right? So the government is trying to regulate your behavior by giving you more barriers to start that behavior. So this is what we call primary prevention. I had a comment, Ernesto. You had a comment?
Like bigger boxes, they put like that like
Horrendous
yeah,
pictures, right? Like mouth cancer,
yeah.
throat cancer, right? And all these different, yeah, like really ugly pictures on the box of cigarettes. Yes, those are definitely to deter you, right, from smoking, or you can stop smoking, right? Stop smoking early. The earlier you stop smoking, the faster you stop smoking, then you can prevent all that smoking related disease down the road, right? So these anti-smoking campaigns, do you guys still see anti-smoking campaigns? Whether maybe on radio or on TV? The what?
Yeah.
Vaping campaigns nowadays, right? Because vaping is like the new thing for, your younger generation, right? And they now that there's all these evidence, epidemiologic data that's coming out that vaping is just as bad as smoking or even worse, right? And so all these on smoking, and its promotion on smoking cessation programs. So they are primary prevention, trying to prevent you from developing that smoking related illness or trying to prevent you from starting to smoke in the first place. Okay. Then continuing with our smoking example in terms of what we call downstream public health intervention, also still very important. This is divided into secondary prevention and tertiary prevention. So secondary prevention here is to be able to screen or detect and address the disease that has already happened, but it is early on so that you can stop the disease progression or at least slow disease progression. So here for secondary prevention is treatment for smoking related illness. So, or you're screening for smoking related illness and be able to detect them early. So, such as if we think about COPD, right? And such as if those smokers, we are following them up in terms of their cardiovascular outcomes. Okay, so pay more of some medical intervention, treatment, as well as patient counseling. Okay. Then last but not least here is the tertiary prevention. So you are on the chronic impact. So tertiary here means that you are managing a very established disease. The disease has progressed, right? However, you want to prevent, you're managing it, actively managing it to prevent further complication, to prevent disability, and to prevent death. Okay, so that is what we call tertiary prevention. So your disease management. Okay, so if you think about smokers, long-term wise, they may develop respiratory illnesses such as COPD, right? And tertiary prevention may be that somebody who has advanced COPD, they are in different programs, respiratory rehabilitation program that help them to prevent that further complication, to prevent disability or death. Okay. Yes, question.
Maybe, um, like primary prevention will be like using, like prophylaxis or using,
Condoms, right? Barrier methods.
yeah, and secondary would be if you have the disease, antiviral, like,
You're treating you with antivirals, correct?
then like the progression of the disease and stuff.
Yes, so if they already have a high viral load that leads to other immune system issues, immune system diseases, or they have AIDS already, okay, and you are preventing, you are treating AIDS as well as you are giving them you know, this rehabilitation, meaning that any other health issues that is relating to AIDS, you're trying to treat that to prevent further complication or to prevent death, essentially. Does that kind of make sense? Great example there. Okay. So there are also other examples here about different public health programs in terms of that upstream and downstream in terms of primary, secondary, and tertiary. Okay, so I encourage you to look at specifically the opioid related example here. And so, one of the things with population-based care, wherever you practice as a pharmacist, I want you to be thinking about medication use evaluation, or also known as MUEs, or some institutions use drug use evaluation or DUEs. Okay, what does that mean? That means that particularly institutions are interested in, particularly for costly medication or high risk medication, is this medication used in the right patient? Okay. Does the patient have the specific indication that's indicated for this very risky or high risk or high cost drugs, right? So if you think about institution, they always thinking about how much they're spending on healthcare, and medication is a big part of it. And if you find that there are patients who does not have the right indication for a high cost medication, this is costing your institution more money, right? And so you want to be able to avoid that. So pharmacists are, or pharmacy directors, pharmacy managers are in charge of conducting these medication use evaluation or MUEs or DUEs in order to see that they will be performance improvement methods that focuses on evaluating, improving medication use processes with the goal of optimal patient outcomes. So it could also be it not only when we talk about high risk medication, it could mean that it has a high probability of adverse drug reactions. Okay, so reasons to use MUEs or DUEs could be based on adverse reaction. It could be based on cost, as I mentioned. It also could be based on drug interactions. Okay, and also the effectiveness of dosing. Okay, looking at different various health outcomes with different doses, also expensive drugs, or if you have heard on a hospital level, there is the PNT committee that meets to in order for a new drug, whether or not the hospital will want to bring it onto the formulary. So also another helpful tool or program or intervention is to conduct a medication therapy management, or also known as MTMs, which you guys, I'm sure you guys have heard of. Is here the purpose of MTMs is to be able to identify and resolve drug therapy problems and develop that comprehensive individualized patient care plans as well as an overview of what are some of the preventative needs of the patient, such as immunization. Okay, so always be thinking about prevention and whether this patient has all their vaccination needs, and also to improve health outcomes through health education, right? And also medication adherence education to ensure that the patient on the right medication, right dose, route frequency, as well as they are taking the medication. So a lot of the times you'll find, patients are just concerned about the side effects. So once you explain about in terms of the probability of the side effects from happening, they can be more reassured on taking the medication, right? So sometimes it's when patients are non-adherent, there may be various types of barriers, right? So you as pharmacists can just talk to the patient, counsel them, and be able to address those barriers. And also here, last but not least, to also identify and address social determinants of health, right? Access to medicine, access to healthcare, uh, and also other different various aspects that is patient specific. Number two here is disease prevention and control. So if you think about preventing disease is to be able to do early screening, right? Be able to detect the disease earlier. And screening programs such as, screening for blood pressure. So that's why we always want to encourage patients to have a primary care provider. So they are going for their annual visits where the primary care provider is doing baseline labs, right? Baseline labs where maybe for your cholesterol panel, also known as a lipid panel, your basic metabolic panel, doing your weight, your blood pressure, heart rate. All those are really important as part of screening for disease prevention. And also immunization status, right? A certain patient population with a certain disease or comorbidity, they need to be on a certain vaccine. So ensuring that they are vaccinated. And flu season is coming, right? We are leading to the fall, and always be asking the patient or encouraging your patients to get a flu shot. And also here, besides screening program, is also chronic disease management programs. Okay, so we have talked about collaborative care agreement, and I gave you guys example, like for example, in my current clinic practice, we have a collaborative care agreement with our medical director. So pharmacists are independently seeing patients to manage their warfarin, manage their anticoagulation, to manage their chronic diseases. So when I was in my fellowship, I was staffing in a chronic disease management clinic where we are, treating and dosing and initiating blood pressure medicines, cholesterol medication, and also type 2 diabetes medication. And that is all under a collaborative care agreement. All right, here table two tells you about preparing for specific pharmacy public health role in terms of in epidemic and pandemic responses. So if you think about back in COVID, right? Counts there was a lot of misinformation concerning how COVID is spread, how the COVID vaccine works, right? So pharmacists are on the forefront because pharmacists, we are the most accessible healthcare provider in the community, right? And you know your community members well. And so when you have that relationship with members of the community, you are able to communicate and educate them on any of these misinformation, right? So poor or confusing information, misinformation. So here they have to be able to communicate and collaborate with institution, where maybe local or state, on providing the accurate health information for the community that you're serving. Okay. And so also informing the pharmacy workforce. So staying up to date. So if you think about, again, COVID, using COVID as the example, because it only happened a couple of years ago, right? Always staying up to date with the latest and the most accurate information from reputable resources, such as the government organization, such as your CDC, your NIH, etc. Here are other roles in terms of role in supply chain management, in terms of securing and anticipation of stock medication and supplies. So particularly if you work in the hospital pharmacy, you'll see that there's always a list of drug shortages that is always that you are distributing to your pharmacists, or so that they can educate on providers that we are short on this drug. So we have to be able to make sure that we are using it on the right patient. Okay. And also, you can also be able to report unusual sale volumes of medication. So this you can monitor on when you're working in a community pharmacy as pharmacists, and just knowing that there are various roles of pharmacists that really can contribute to public health. So we talked about role in supply chain management. Now there's also role in pharmacy operations. So for those of you who are interested in pharmacy operation, becoming pharmacy managers, pharmacy directors, and here is in terms of epidemic and pandemic, is to be able to supply rapid response kits as well as the timely access to treatment for your patients. Okay, as well as taking that leadership in medication use and medication safety. Okay. The role of infection prevention and control. You can see that in terms of updating policies and procedures. So this was very rapidly moving during COVID in terms of what are some of the new guidances from national government organization, state and local health departments. So updating those policies and procedures, ensuring that you have enough protective gear for your workforce, so for your pharmacy staff members, as well as be able to monitoring your own pharmacy staff member for symptoms of the COVID. Okay, as an example here for fever, cough, and shortness of breath. And remember back in the COVID days, whenever you're entering healthcare facility, they need to take your temperature. There's always hand sanitizing stations everywhere, right? And you need to be wearing a mask and also protective gear whenever you're entering patient rooms. Okay? So that would apply if we were to have another pandemic or epidemic or any sort of viral infections that is in the hospital. You always need to be in protective gear when you're going into patient rooms. So role in patient care in terms of triaging, okay, triaging patients in order to treat the sicker patient first. So this is in a setting of epidemic or a pandemic, right? Requests. So this also has to do with a lot of team-based care, meaning working together, okay, working together. So nurses, pharmacists, medical doctors working together to treat the patient, reviewing your latest information, updating that policy and guidance, as well as providing accurate information to your patient as well as other healthcare provider. So that was part of disease prevention and strategies. Number three is medication safety. As I mentioned, like our bread and butter is medication. So everything that this is one of our primary responsibility to ensure the safety and the efficacy of medication. So adverse medication events cost over about $30 billion per year. And not only that, there's also what we call the incalculative cost. That means cost that you cannot able to calculate for the suffering and productivity loss of patient that suffers from these adverse medication events or from adverse drug reactions. Okay. So it's also really important for us to have that comprehensive medication instruction, meaning, let's say the patient's getting discharged from the hospital, you are educating the patient on why they're on this medication, how should they be taking it, what the frequency of taking it, and what are some of the side effects. Okay. And identifying potential medication related adverse drug events. So always be thinking about running a drug-drug interaction when you have a whole list of medication that the patient's on, right? And if there is significant drug interaction, to be able to make that recommendation to the healthcare team on other alternatives that would have less drug interaction and no drug interactions. Okay. Or if the patient needs to be on both medication, strategies on how to reduce the effects of those drug interactions. Okay. So a lot of times in my anticoagulation clinic, we see that patients, they're on warfarin, right? There's a big drug interaction. If patient has some sort of infection, they're using an antibiotic. They have to be on the antibiotic, but however, the antibiotic will have a drug interaction with the warfarin in terms of increasing the INR. So increasing the INR, meaning that we may have to reduce some of the warfarin doses so that the INR will still be able to stay between the range of 2 to 3. So, does anybody know what INR means? Normalized ratio. And what does INR mean essentially? Risk of bleeding or clotting, yes. Okay. The way I explain to patient, IR means how thin your blood is, right? So we have a goal. So usually is a goal of 2 to 3. Okay. So it's a value that we take your blood and we see a value of INR. That means how thick your blood is. So typically all of us not on blood thinner. Well, what's our INR typically? Does anybody know? One, very good. It is one. Okay. So under normal circumstances, us as healthy individual, we have an iron of one, clots should not develop. However, you have different conditions, right? Patients already develop a clot. So you want to be able to use warfarin to thin their blood to the goal of 2 to 3, okay, so that they do not develop a clot again, okay, or treating that blood clot. So if your INR goes beyond 3, you have more risk of bleeding. Okay. If it goes below 2, you have more risk of clotting. Okay. So that's why we have that goal INR of 2 to 3. Okay. And so, as I mentioned, giving you this example of that patient needs to be on antibiotics. However, they need to be on warfarin, right? But however, there's a drug interaction. And so you need to be managing the effects of those drug interaction. So managing is to decrease the dose of warfarin, and we also will be monitoring the patient a little bit more closely, meaning that they'll come back to our clinic a little bit sooner than other patients who are stable on a particular warfarin dose. Okay. All right. So that's an example of how to manage drug interaction. Okay. So then also to problem solve and to decrease future medication related adverse events. Has anybody heard of medication reconciliation? Yes. What essentially is medication reconciliation? Does anybody want to give me a definition or from what you know of what is medication reconciliation?
Ensure that information of the institution is getting versus what the patient actually is taking from home, like they they make sense and they
Match.
information is correct.
Yes, absolutely. Very, very good. So, yes, yes, round of applause for Jose. Okay, very good. That's exactly what it is, right? So, so a lot of efforts has been going, you can see from historical data in terms of why they are employing a lot of what we call transitions of care pharmacists, and also for pharmacists and pharmacy technician or pharmacy students when you go on rotation in the hospital to do medication reconciliation is because they found out a lot of the medication errors that happens within the hospital is because of not having the correct information. So medication reconciliation. So if you ever had heard of it, when patients go into the hospital, they'll have somebody that is pharmacy based, where it may be technician. Sometimes they'll let students do it. They will train you on it, or pharmacists do it. Is that they are asking the patient, "This is what we have in the chart. Is this what you're taking at home?" So not only asking the patient what they're taking, but also calling, right? So if they're coming from a long-term care facility where there's somebody that's managing the medication at the long-term care facility, the pharmacists are calling them to confirm and to double check what the patient is saying is correct. You're calling the community pharmacy where the patient usually picks up medication and ensuring that is this what they're on? When was the last time that they picked it up? Right. And in that way, you can also be analyzing what are some of the medication adherence issue, right? And so medication reconciliation is to reconcile or to ensure that what the patient is taking home is translated what they are taking in the hospital. And based on why they are admitted, there may be some adjustments. But at least from the medication medrec, or we call it medrec perspective, is that you're ensuring that you have the most correct and up-to-date medication list in terms of medication name, dose, route, frequency. Okay. All right, so you can see here statistics or research have shown that pharmacists help to reduce emergency room visit and hospitalization by 30%. Okay. And if you think about a lot of technologies are helping us to reduce medication errors by barcoding, computerized provider order entry systems, infusion pumps. Okay, a lot of times your electronic health system has a lot of measures or sometimes pop-up alerts that really helps this process of ensuring that the patient is getting the most safe and effective medication. So the Institute for Safe Medication Practice, so it's a national organization. The ISMP is a really important organization, and we'll have one lecture that specifically focuses on medication and talking about some of the recommendations of the ISMP. They have various recommendations concerning medication safety in different practice settings. Okay, whether it may be community or ambulatory, maybe acute care, for nursing, for long-term care facility. They even have information for the consumer. Okay. They have a monthly newsletter sign up, which I highly recommend everybody to sign up for these, particularly when you start practicing as a pharmacist. Okay, so you can click on that link and you can see all the medication safety alert that currently exists in various settings. Okay, you can sign up for the newsletter to follow up on these medication safety alerts. Number four is to be able to efforts to address the opioid epidemic. So you can see that over the years, there is a significant increase in the use of opioids. Okay. And over here is the two colors. The yellow is for male and the orange is for female. And you can see that particularly in the male population, there is a higher increase in opioid use compared to female. However, both genders are increasing. And so one of our roles of pharmacists in public health is the efforts to be able to address the opioid epidemic. And you can see here some statistics. About 96,700 people die from drug overdose per year. And opioid accounts, unfortunately, for 7 out of 10 overdose deaths. Okay. And so this comes the idea of the opioid stewardship. Opioid stewardship. and pain management. So there's a lot of more pain management clinic that you can see in healthcare system and in hospitals. So we collaborate with providers in treating acute and chronic pain by first what we call stepwise therapy in terms of letting the patients use opioid alternative first. So what is our go-to pain medication that you know of? Acetaminophen, also known as Tylenol, right? Tylenol is probably your go-to, right? I always tell patients your go-to for pain is Tylenol, or for patients who are on warfarin particularly, because with NSAIDs, there is more risk of bleeding, right? And I try to counsel patients on using Tylenol first. Obviously, there's a maximum dose for Tylenol. Does anybody know what the daily maximum dose for Tylenol is? 4,000 milligrams or 4 grams. Okay, very good. All right, so for your non, this is what we call the stepwise therapy, meaning that has the patient trial other pain medication, such as Tylenol? Have they titrate to a maximum tolerated dose? Okay. So not just titrating to 4 grams, but what can the patient tolerate? So noting that. So what we call titrating to the maximum tolerated dose by the patient. Okay. And then also using different class. So after you use Tylenol, adding on an NSAID. Okay. So noting drug interactions, adding on NSAID and titrating each of the NSAIDs up to maximum tolerated dose. And then also adding some what we call non-opioid adjuvant. Okay. Some treating for pain such as gabapentin. Okay. That's also treat for very good for neuropathic pain. And gabapentin, the dose can go all the way up to 3,600 milligrams. Okay. And so also dividing the doses like 3 times a day or twice a day, okay, and see if that helps with the pain. And then all the way up, if all those does not work, you the step up therapy, then last line medication is to use the strong opioids on top of those non-opioids adjuvant or alternatives. So here the aim here is to decrease over prescribing, okay, and also to reduce the risk of abuse and addiction to prevent that diversion. We talked about the prescription drug monitoring programs. So I'm sure you're seeing, if you work in a community setting, are you seeing pharmacists checking the prescription drug monitoring programs, right? Particularly when they receive in controlled substance prescription, or particularly opioid prescription. They're checking whether or not patient has recently picked up from other pharmacies within your area or within your state. So due to time, very quickly, what is the name of the medication used for opioid overdose? Naloxone. Yes, absolutely. And so noting that there's also resources on the Maryland Department of Health. They have particular resources for overdose response programs. They also have links to places where you can pick up free naloxone. Okay, they have a whole naloxone program. Find naloxone near you. Okay, so if you this is again a resource for you on the state health department level. Number five is to do with health education policies and programs. So here is developing, promoting, implementing education programs across different stages of life. So patient education programs on educating on the safety and the efficacy or effective medication use to improve health literacy, helping patients to understand why they're on their medication, how to take their medication, how to manage their medication, okay? Improving adherence of medication, as well as the what we call the non-pharmacological interventions, right? So always your lifestyle intervention should always be your baseline on top of using medications. So educating on that and ensuring adherence on those as well. So enhancing individual role in their care and health and building that trust between pharmacists and healthcare system. So when you're in the community, you have that relationship with your patients. You know, a lot of the times patients have a lot of mistrust in healthcare. So they trust you as the pharmacist. So you want to be able to, educate them on, these medication as well as if they have answering any questions on healthcare. Okay, here are some examples of patient education programs, goals and method that's aligned with Healthy People 2030 goals. This is due to time constraint. I'll let you guys go through each of these. These are very, very good examples and also some ideas for your public health campaign topics. Okay. Number six, to be advocating for public health policy in terms of that participation, right? When you participate in your local community organization or your professional organization, also on the state level or the national level, you'll be able to get involved in those policy developments through local boards of pharmacy that could translate to national programs. Okay, so the focusing on policy surrounding medication, safe and effective use of medication, okay, and understanding that relationship. So you are the medication expert. So you understand that relationship of medication therapy and other factors that could affect patient outcomes. You are able to educating legislator, regulators. So remember your legislative day that you guys went to Annapolis for, right? Is to talk to legislature concerning policies surrounding improving patient outcomes. Okay. So APHA have this action center and pharmacy's top priority in terms of legislation. I really encourage everybody to take a look at those and also to advocate for our pharmacy profession as well as advocate for better patient outcomes. Seven, research and training. So strive to be proficient in research methodology. So we're going to talk about pharmacoepidemiology and biostatistics. So biostat, you guys have done a little bit or overview of it in your clinical research and design class, CRD. We'll talk about or practice more on biostats in your evidence-based medicine class next semester with me, and then we'll apply those examples as well, okay? Seek experience in design, implementation, analysis, interpretation of clinical studies. So we will go through those in evidence-based medicine class, but there are also research opportunity. And I know that some of you guys are already involved in research with some of our faculty here at the School of Pharmacy. There are also opportunity for collaborative research when you become a pharmacist. So currently I'm working on a project that has to looking at the effects of antibiotics on INR and also how our pharmacists are managing those warfarin doses in our clinic setting, right? There's always so much to be done. It's looking at to be able to observe that health trend or health problems and how do you find the evidence and solution to solve those problems. Okay, exposure to public health policy, pharmacogenomics, health-related quality of life, and evidence-based medicine. So that research and training part. Continue learning, right? One of the 7-star pharmacists by the WHO is that lifelong learner piece. So last but not least, what kind of pharmacist do you want to be? So I know that we have talked about, someone has talked to you about there are over different 100 pharmacy career pathways, right? So the difference, the description of specialties. So I encourage you to click these links to take a look at them, to think about what kind of pharmacist do you want to be and have your impact in public health. Last but not least is the International Pharmaceutical Federation. They have a section called Young Pharmacist Group. They have a career development kit that I also find very interesting and useful. They have algorithms in asking you what you're interested in, yes or no, and they will have a list of potential careers for you. And so I encourage everybody to take a look at these resources and think about what kind of pharmacist you want to be to have your impact in public health. Alrighty, so that brings us to the end of Roles of Pharmacists in Public Health. Remember that next week, Tuesdays and Thursday, Dr. Morriganji will come and talk to you guys about epidemiology and population health. Exercise 1 opening next Thursday, and it is due the following Friday. Okay. If you have any questions or concerns that I can help to answer on anything, please feel free to email me or come to me before and after class. Thank you very much.